All that is to get to the point of, hey, now we have sleep appliances. What do we do with them? So oral appliances now for the management of snoring and obstructive sleep apnea. You're going to hear oral appliance therapy referred to by many terms. You will get letters with them in many terms. Oral appliance therapy, mandibular repositioning appliance, mandibular advancement appliance. The MAD and the OAT terms are ones you're going to see a lot. MAT you'll occasionally see, upper airway device you'll occasionally see, but you're going to get letters and articles in which they use any of those. It's oral appliance therapy, oral appliances. How do they work? Oral appliances are placed in the mouth during sleep to prevent the oral pharyngeal tissues in the base of the tongue from collapsing and obstructing the airway. How do they work? In what way? Number one, they reposition the mandible, tongue, soft palate, and hyoid bone. They work different ways. There are some that work each way. The ones I tend to use is they reposition the mandible forward, it repositions the genioglossus muscle forward, pulls the tongue forward. They also stabilize the mandible, tongue, hyoid bone. They increase the baseline genioglossus muscle activity. It stimulates the tongue to be a little more active and not collapse. And muscle activation of the pharyngeal walls. As the mandible's pulled forward, the muscles tighten a little bit and expand the pharyngeal walls. Types of appliances. We need to understand lots of appliances. Don't get focused down on one. How they work, what they're made of, all sorts of variations. The functional classification of all appliances. You have tongue-retaining devices that pull the tongue forward. You have mandibular repositioning appliances that pull the jaw forward and pull the tongue forward and activate the pharyngeal muscles. And you have a combination of oral appliances and CPAP. Oral appliances for obstructive sleep apnea. Tongue retainers with mandibular advancement. That's your first group. Then you have mandibular repositioning appliances that you can not adjust and the patient can't move. You can have mandibular reposition appliances that you can adjust, but the patient can't move in them. And then you have mandibular repositioning appliances that are adjustable and the patient can move in them. These are the only ones that are really getting use at this point. I'm going to show some others for historical use, but no one wants to put a patient into an appliance which they bite into and then can't move their mouth for the rest of the night. And then we have appliances that help the folks use CPAP. Non-custom, over-the-counter sleep appliances for patients to say, oh, I tried one from Walgreens. They don't work. They don't hold the teeth well. They are much less effective and they are never a predictor. There have been several studies. They are never a predictor of whether your final appliance is going to be a success or failure. They can't be titrated. The patient can't move. They don't know where they're positioning. So over-the-counter sleep appliances, boil and bite, are never an indicator of whether your appliance is going to work. Tongue retainers. If you don't have tooth support, they're edentulous. If you have active TMD symptoms and you can't move the jaw forward. If they have mild OSA and they can't tolerate one of the other appliances. This super large tongue, it may help it stay in the tongue retaining device better, but it's questionable as to whether it's really being used. I'd have several of these around. At least it's something to offer a patient. Obstructive sleep apnea worse in the prone position, then you may try one of these tongue retaining devices. You've got to keep an eye on them, how they're working, check up, see how the patient's doing. Here's a Snorex. I don't even know if it's still available, but they stick their tongue in there, they squeeze the bulb, the suction holds the tongue in place, and that keeps the appliance forward of the front teeth. You have tongue retaining devices that can also move the jaw forward. Effective if you find the right position, but not effective if someone needs to move the jaw. What this would do is you'd move the jaw forward, you're opening it up. No one opens up the jaw this much anymore because it actually causes problems. And a tongue retaining suction bulb. Here's one that you may look at sometime. Knight Laboratories does a very good job, which is a tongue retaining bulb and has moved the jaw forward and has airway tubes. Just these are not really in use anymore. You have simple, these things cost probably $50, $60. You charge $120. This is a long enough piece, they stick their tongue in it, they squeeze it, the tongue is held and forward, and those go along the ridges or the teeth. This is another simpler one. It's not enough teeth, and it will fit extraorally. Mandibular repositioning appliances, you need to be able to tell your physicians that there are studies, and in the last few years these are historical, but there are more and more studies backing up the effectiveness of our oral appliances in mild to moderate sleep apnea and their use in severe sleep apnea for enabling CPAP. We've got the studies, they work. Mandibular repositioning appliances that are non-adjustable, non-titratable. Old ones, we don't use them. No one's going to bite into that and not be able to move their teeth. Another, bulky, but these were our original appliances. Mandibular repositioning appliances that are adjustable, titratable, but the patient can't move in them. Still not, they're a step in the right direction, they were a step forward, not usable now. Very easy to use, Norrad, Airway Dilator, boil and bite, can help hold the jaw forward. The adjustable PM positioner, this was designed by Jonathan Parker. Let me mention Jonathan Parker for a moment. Jonathan Parker, you'll see his name in the sleep literature. He is probably my mentor, he is my mentor in the field. He is one of the most gentlemanly, honorable individuals you will ever meet. If you are looking for someone to do some more, with whom to study more in dental sleep medicine, he would be the man to go see. He practices out of Minneapolis, St. Paul. He does not lecture on why you should use his appliance. He doesn't make a profit from anything you use. He will tell you what works, what doesn't work, and I think he's one of the best people to learn from. So if you get the opportunity, make the trip, it'll be worth your while. The mandibular repositioning appliances that are adjustable, titratable, and movable, so the patient can move in them, these are the ones we use. They're the most versatile, they're the most comfortable, and we get the best results, highest compliance. If you have someone that needs something inexpensive, you have the EMA appliance. Now there are two EMA appliances. There's an EMA first step that you can use on a suck down in your office. There is the regular EMA that you have to go through the lab. Pittman Dental is here, they do them. It requires a BioStar type pressure forming machine, it requires some other steps, and the lab will make them for you. The company will not sell a dentist the regular EMA appliance kit. They will sell the EMA first step to the dentist, done in the office, make sure it works, then you can go to the heavier duty EMA regular. But do speak to the folks at Pittman, they can help you with that. Here's a close-up, you've got a heavy duty material and you've got these replaceable bands that will let you move the jaw forward in 1 millimeter increments. When you are, and they're slightly different designs over time, how that ring is held on. And it's evolved, but both these work well. You then have the MyTap. Now the MyTap is designed by Keith Thornton, who has patents on lots of things in this field. Don't try to use one of his designs without buying his hardware. If he hears about it, he will go after you. Brilliant guy, but he feels he owns a lot of this technology. The MyTap, it's a boil and bite appliance. You boil the upper appliance, put it to place, and it forms. You do the same thing with the lower, and then you titrate with a plastic screw coming through this piece. It is a good appliance when you need something immediately, or you need to see how someone responds. The two problems I have with it are that it's an irradiated material that shrinks when it cools. So to me, it's tight on my teeth, but my teeth are sensitive. Most people do fine with it. You can adjust it, adjust it, adjust it, and then when you get to the point where it needs to be, you can do some things to sort of glue the pieces together so there's still some movement. It's called the MyTap, and it's a good emergency appliance. There's another one I like as emergency appliance I'll show you later. But here's the design. You boil and bite the upper, boil and bite the lower, let them cool, put them together, put them in the mouth, and then that screw that's fixed to the upper pulls the lower member forward. And they supposedly last upwards of a year. Now whether they do, whether they're used, still too new to tell. And here's the design apart. Our basic appliance was the Herbst. And we all know that from ortho, move the mandible forward to encourage growth and development. You have the Clearway oral appliance that was developed by Dr. Alan Lowe's group up in British Columbia, Vancouver. And a lot of the research you'll see coming out of that group with Fernanda Almeida now taking the helm. If she writes an article, it's going to be well researched. So good information. This was their original design. Canada supports its dental sleep field very well because they're saving a lot of money on their medical costs that way. So a lot of research is coming out of there, and there's some good people working in the field in Canada. This is the silencer system. It's an older system. This is a Norrad. I don't even know if it's available anymore, but I think it was worthwhile to have that as an alternative. I can't locate them. TheraSnore. It's adjustable, but not real usable. The Thornton adjustable positioner. I don't like it. I don't like anything in the way of the tongue. Anything up there, I believe, causes the tongue to retract, and I think the patient's going to play with it. This is the newer, the Tap 3, which is a lot better, but still has something in the way. This is the Moses appliance. If you've ever met Alan Moses, he believes very passionately in his appliances and his work. He's very much a neuromuscular dentist and believes that this is designed to encourage the tongue to lift up and forward. And it's a very beautiful blue color. That's important. We're getting into the appliances I like. This is a Suad appliance. It's by Patrick Strong at Strong Dental in Canada. If you've got a bruxing patient that breaks whatever else you put in their mouth, this is the appliance to go to. It's very well constructed with a metal partial frame around the teeth and then the acrylic around that for retention. It's a Herbst design, and you have the pins or posts to place adhesive to keep the mouth, elastics to keep the mouth closed. Here's another look at it. Very well made appliance. Here is the type I tend to use, what's called the fin coupling appliances, where you have a fin on one of the members and a block that's pushed on the upper. The original design of this, well, it's not the original design, but the folks who really made it go were the Somnodent people. Somnomed, it's called the Somnodent appliance. This is the Dorsal appliance by another lab, and it's basically the same design. I like longer fins, and I like good, strong construction. This is a new Narval appliance. It's CAD/CAM done. This is a nylon material. It can be slightly adjusted, but you're not going to get major adjustment out of the fit. Various pieces here adjust how far you're pulling the mandible forward. This is going to grow into a more popular appliance because it is so lightweight. I haven't used them, I've played with them, but I think this will be a bigger one in the field. This is a great little device. One of the dentists that lectures in the area called me and said, I've got a patient that I'm doing full mouth reconstruction on, or I'm doing dentistry, and she's got sleep problems. Can we treat her concurrently? I will tell you, absolutely not. Absolutely not. The reason being that when you use these appliances, it's going to be pulling the mandible down and forward. When you're trying to do construction of any of your dental restorations, you've got to have a stable seating of the condyle and a repeatable centric. You can't do dentistry at the same time, or major dentistry at the same time you're doing sleep therapy. You got to choose one or the other. If you've got a patient that you basically need to do 1 or 2 crowns or some fillings, and you absolutely need a sleep appliance right away, then you buy this Apnea guard from Great Lakes. What this is a pair of trays locked together. You have the person, you reline this, it's got some little nibs in there that help hold your impression material in. You do an impression of the upper arch, impression of the lower arch, you pull the jaw forward, you get the position you need to be, and then you can cut off a lot of this extra and just put a little screw or wire through here so they have a little movement and you don't have this thing sticking out through the lips. You do some crowns, fillings, you pull out the impression material, you re-impress. Appliance selection. Does it matter whether it's an over or under appliance? No. Does it matter whether it's push or pull appliance? No. Push equals pull. Whether you're pulling the mandible forward or pushing the mandible forward, you'll get the same results. You go by the patient's needs and the doctor's needs. Appliance selection. Allow room for the tongue and an open anterior for the tongue to move forward. The tongue wants to come up, forward, and move laterally. If you crowd it out, you will have problems and you'll compromise the airway. Avoid excess lingual acrylic. The tongue will touch it, tend to drop back, crowd the airway. Avoid excess lingual palatal hardware. I don't like the taps. That's where the tongue wants to be. I want the tongue to feel forward. To feel comfortable coming forward. Avoid appliance corners and excess points. The tongue touches those, it will cause the tongue to retract. The tongue has 7 different reflexes. It will retract on contact. Give it room, don't have sharp points. Retraction of the tongue constricts the airway. Don't encroach on the tongue space. Allow the tongue to stay out of the throat. Now, this is from Jonathan Parker, appliance selection. I tell you that my 2 favorite appliance groups at this moment in time are the Somnodent type appliance, and for bruxers, those who break, those who have movement disorders, the Suat appliance from Patrick Strong out of Canada. But different patients have different needs in their appliances. Different doctors have different needs. So what you need to do is learn 10 different appliances and learn what material is used, what allergens are in it, what type of retention it is, ease of use, how the patient will tolerate it, be able to. You can have the most effective appliance if the patient can't get the appliance in and out because they're 89 years old and have arthritis, it's not going to be used. So look at all these factors. I'm not going to go over them. Jonathan Parker's put a lot of work into this. What are your patient characteristics? Are they a heavy bruxer? What is their ability to work with their fingers? What does the patient want jaw movement? Does the patient say, no, I want to bite into something and have it fixed? Are all these in your pages? Okay, just want to make sure I hadn't missed something. So then what you do is you draw a chart. You have appliance A, appliance B, appliance C, appliance D. And then you say, hey, they're a heavy bruxer. Which of these appliances would be good? They don't clench and grind. Which of these appliances would be my favorite? And then you get to the bottom of it, whether you've done it manually or mentally, and go, hey, this is the appliance fits my needs and the patient's needs. This is the one I'm going to use. So the person that says to me, what's your favorite appliance? I'm going to say, what's your favorite characteristic for each patient? Do they have good manual dexterity? Then you can use certain ones. Do you need adjustable retention? You need other ones. Does the jaw need to be held in a closed position? Well, then there's certain certain ones you can't use. Does the jaw need to be opened by the patient to yawn? Well, then you can't use a tap. So that's how you evaluate. But Jonathan Parker has done that for the profession. Appliance selection. If the patient is a back sleeper with position-dependent obstructive sleep apnea, you want the appliance to not allow the mandible to fall open. So you need one with decent retention and you need one that doesn't fall open. Or, so you can use the tap appliance. Again, I don't like the tap appliance because it's got stuff in the way of the tongue. I like the Somnodent or the Suad with elastics on the side so the patient can't fall open. A dentulous, sometimes you can only do vertical dimension for these patients, so the Silencer Professional is one you'd like to look into. Some interesting things coming out, and the number of appliances and the new techniques available in dental sleep medicine are incredible. What's available now is 3 times what was available 3 or 4 years ago. Dr. Brian Karopian has an appliance which basically strokes the back of the tongue, elicits a reflex for the tongue to move forward, and has recently, and that's called the full breath solution appliance. He has recently taken little plastic tubes, attached them to oxygen concentrators, the type that people walk around with, look like a giant thermos, and concentrate oxygen for them to breathe. You see them walking around with the nasal cannulas. He's piping that in and is showing some amazing results using his full breath solution with that piped in O2 with a very thin flexible tube, calling it the full breath O2 appliance, and shows some great results just out in the last couple of months. And that's how it hooks up.